If your child ever gets this, it's most likely going to be at night when your pediatrician's office is closed, and now you're stuck with trying to battle, do you go to the ER or what do you do with them? At the end of this video, I'm going to review with you what Croup is, what causes it, what you can do at home to make them feel better, and when you need to go to the ER. And also what we typically do in the ER, so that way you're aware if you end up in another hospital, so you can know what questions to ask. Croup is another name for a fancy big word called laryngotracheal bronchitis, which is essentially an inflammation of this part of the airways. It is common in kids between the ages of 6 months and up until 3 years. I can even extend up until 5 years of age. And this is because the part of their airways, or most parts of their airways, are smaller. And when they get inflamed and swollen, they tend to get narrower. Viruses cause croup. Most times these are caused by all viruses, but the most common ones are parainfluenza, flu, and COVID. So a lot of people ask, what is with that sound? So because the inflammation is around the location of the voice box, kids tend to sound like they lost their voice or even sound like a seal. And you also tend to hear like what we call a stridor-like sound because the airways are pretty narrowed and air is trying to squeeze through that small hole. In the beginning of the video, I mentioned that the symptoms tend to happen or get worse at night. And that's because the human body's steroids, mostly the cortisol, tend to be higher during the day and wanes or declines down at night. So because it's lower, the swelling tends to get worse, and our babies or our kids might tend to have more symptoms at night. What do you do when you notice your child making that sound? Or what do you really do when you notice them getting sick? I want you to do a quick assessment of your child. So besides the sound you're hearing, what does your child look like? How fast are they breathing? Are they breathing too fast? Are they breathing normally? Are they having pauses in their breathing? How hard are they walking to breathe? Are you seeing any what we call retractions, any tugging? If you're seeing any of those and your child looks uncomfortable and sick, please pause and take them to the nearest emergency room so they can get an assessment. If your child has none of those, let's talk about some home remedies and things you can try before heading to your regular pediatrician's office or maybe heading to the ER to get seen. Number one is steam inhalation. So kids may respond to hot mist or cool mist. So I'm going to talk about the steam inhalation first. You take your child to the bathroom and turn the shower or bathtub or whatever you have at home on. Don't take them into the bath. Stay outside, close the doors and all the windows, and let the hot water steam up the whole bathroom. Number two option is, which is actually my favorite, is take them to the kitchen. If you have a refrigerator or a freezer, open up one of them and have their faces go in there. You can go in there with them to just kind of make it a little bit fun and less traumatizing for them. Let the cool mist hit their faces and let them breathe that in. That has been shown to help them breathe and sound better. Another option that I really like, especially in the cool area, when the weather is cool, take them outside for a drive, make sure they're in their car seat, and have the windows down. The cool breeze and the cool air makes them feel better, and some kids even sleep off on your way on during your ride. If driving out of the house is not an option, that's okay. You can still put their jackets on and take them just outside the door and let the cool air still hit your noses. If your child feels a little better with the therapy you just tried, they may still have a barky cough when they cough, and that's okay. It's okay to lay them back at night. You don't have to rush into the ER immediately unless you think your child needs to be seen. You can call your pediatrician in the morning, or you can call the pediatrician's office and let them know what happened. In most cases, they may send you oral steroid medication, which can be taken at home. Kids with croup can also have fever, so if it happens in the middle of the night, you can also give them fever medication. Let's talk about the first scenario that I mentioned before, where your child is struggling to breathe, in distress, or maybe breathing a little bit fast or having a lot of work of breathing, and you have to take them to the emergency room. What actually happens when you get to the ER? In the ER, we examine the child like every other child we do. Your doctor or your provider comes in, they examine, ask you questions again, and make sure there's no suspicion of other reasons why your child might be struggling to breathe or making those sounds. Most kids with croup get oral steroids. One of the most common ones is dexamethasone, which a lot of us know as Decadron. One of the reasons why we love Decadron is because it's one dose that's only needed in most cases, and it usually lasts between 2 to 3 days, and most kids don't need anything else. There are other kids who may be struggling to breathe and may need an inhalation or medication, what we call racemic epinephrine, which they usually inhale, over their faces. Racemic epinephrine is usually confused with albuterol because they're given the same way, but it's not the same thing. Albuterol is a medication for asthma and is usually not given for croup. Racemic epi is given to also help the swelling, which occurs at the back of the throat like we talked about before, and makes your child breathe better. Racemic epi works super fast. Within the first 10 to 15 minutes, your child feels better. We usually have to observe them for about 2 to 4 hours because the swelling may rebound again or your child start working hard to breathe again. Leave you and your child alone and come in and assess them intermittently. If we come back and notice your child is having difficulty breathing while they are at rest, we may give another dose of racemic epi. One child may come in and need only 1 dose of racemic epi, feels better in 2 to 3 hours and goes home, and another child might need multiple doses of racemic epi to feel better, and they tend to be admitted for those reasons. So at this point, you're in the ER, there's a possibility your child might go home because you're observing, or they might have to be admitted. What else do? We may give them fever medication, because we mentioned before, croup is caused by a virus, and viruses can cause fever. So we can give them fever medication. We can let your child drink if we think they're not working too hard, but if they're in distress, we tend to hold off and not let them eat or drink anything. So that way, if we need to intervene by any means, we don't want to have any complications. X-rays may or may not be helpful. In some situations, we may do X-rays, chest and neck X-rays, just to make sure there is no foreign body, especially if your child is not responding to racemic epi. We want to make sure there's no foreign body that's stuck. So we tend to do X-rays in those scenarios. Here are things I want you to remember. 1, croup sounds are mostly the same in all kids, but not all kids look the same. If your kid has a sound and they look in distress, they need to be seen so that way they can be taken care of. If your kid has a sound but looks comfortable, the home therapies are helpful. If you forgot the home therapies, I want you to go back and watch this video again so that way you can see what home therapies to try first. Croup can cause fever, so I want you to also treat the fever and make sure your child is comfortable. So most kids get 1 dose of dexamethasone, which is the steroid we talked about, and some others may need 2 doses, essentially within a couple of days down the line. And that's okay, but I want you to know that if your child is requiring multiple doses of medications like racemic epi, multiple doses of steroids, it's okay for you to ask for another opinion or ask for an ENT in the clinic to make sure there's nothing else going on. Leave me a comment in the comment section and tell me what you learned about croup, what helped your child and what did not, and other things you would like me to discuss about. Don't forget to subscribe.